PCS for about 2.5 years. What advice or support could I give to new users? Basically just stick at it, ask for help when needed, trust the process, and soon you'll be asking yourself, why didn't we start this sooner?
I'm Nav. I'm a physiotherapist. I've been using PCS for about 2.5 years. And where do I go when I need help? I don't need help because I was a super user, but if I did need help, other super users and Harjeet was always available for any sort of assistance.
Personally, as a resource nurse, finding things on the status board is so much more efficient than paper charting. The status board lets you see all the interventions that were ever done on that patient, so the clicking through and the ease of finding interventions or conversations that were had is night and day. It's so much more efficient, and I'm really thankful for that. You're not deciphering people's handwriting anymore. Facts are at your fingertips. Anything that Allied Health incorporates is just a click away. As we go into the future and we are collaborate with multidisciplinaries, having that access and those information and that assessment right away, as soon as they hit save, has saved us so much time. We can put together care plans faster. Delays in care aren't as frequent because we have all that information at our fingertips. Doctors access it, residents, everyone's on board, and that integration has been fairly seamless, and we can't imagine going back anymore.
The most challenging part with documentating on the new online charting system was just getting used to where to document everything. But after a while, a couple of tries, you get used to it and you find that it's actually a bit easier than the paper charting.
So some of the positive changes that I've seen in my practice here in the pediatric NICU as well as downstairs, it's a lot faster. I can do my charting in half the time. I noticed that to gather information is lickety-split, so I can pretty much pull up one document and have all the information on hand. I really enjoyed the IPOC program. We're in that position to be on that team. They're a wonderful team, and go purple shirts.
We are going on 2.5 years now, almost 3 years with electronic charting. It was met with a little trepidation at first, but with the extra staffing and the help of the e-charting team, the rollout, I want to say, the first assessment was painful and there's a lot of nerves and staff were intimidated, but by the end of their shift, they were pretty comfortable. We do assessments a little bit more frequently in ICU, so they got really good practice with it. But now we're fairly comfortable with it, and the overall feedback is that staff, they couldn't go back to paper. Even ones that are more reluctant to admit liking e-charting, they admit they would never go back.
I work at Abbotsford Emerge, and I was a huge skeptic of PCS, EDM. I was worried that it would take time away from my patients, and I was worried that not all the information would be covered. With time and lots of work, we have made the changes to PCS and EDM that we've needed. There's still many changes to come, but we work with PCS, EDM with relative ease now in the Emerge department. And I'm no longer a hater and more of a lover.